Software and analytics are key for transforming healthcare innovations from idea to reality. But how can a provider or startup company access the technical resources to make it happen? Let's talk about the month of December. Well, some people think that wrapping up in a blanket with a mug of hot chocolate or watching a movie with the family is the best way to spend the last month of the year. For others, it's ice fishing or tobogganing. But speaking of comfort, therapy is a great way to bring yourself peace that never goes away, even when the season changes. BetterHelp offers entirely online therapy. It's designed to be convenient, flexible, and tailored to fit your schedule. Just fill out a brief questionnaire to get matched with a licensed therapist and switch therapists at any time for no additional charge. It's helpful for learning positive coping skills and how to set boundaries. It empowers you to be the very best version of yourself. So whether you're dealing with stress, anxiety, or seeking personal growth, BetterHelp connects you with licensed therapists who can support you on your mental health journey. Make it a great season with BetterHelp. Visit betterhelp.com/CareTalk to get 10% off your first month. That's BetterHelp, HELP.com/CareTalk. Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Richard Kedziora, co-founder and COO of Estenda, which provides custom software, data analysis, and AI solutions for healthcare and medtech. Welcome, RJ.
Thank you, David. Thank you for having me.
Now, you talk about transforming health data into health improvement. What does that mean?
Think about how you get data today. There are so many wearables on the market, or your lab results that you might get for this physician. Lab results are a single point in time. What are those? What does that data mean? If you're wearing a ring or an Apple Watch today, it can generate all sorts of information about your heart rate, your blood pressure. You're wearing a continuous glucose monitor or just using finger sticks. What does that blood glucose information mean? So that's what it's all about, is how do we take that data, sometimes longitudinal, sometimes single point in time. How do we turn that into health improvements? How do we find the patterns, trends in that data? And then how do we make recommendations and help you improve as an individual or as a provider to provide better care for your patients?
Makes sense. A lot of times we hear about, turning data into information or insight, but that's all well and good. But if we're dealing with health data and you're wearing that ring, you might as well actually see your health improve, not just your insight go up.
That's what it's all about. Like if I'm, don't sleep well last night, okay, let's figure out why and how can I improve that?
What do you think is the outlook for digital health post-pandemic? A lot of changes occurred. I think you saw in 2 weeks in March of 2020, more use of telehealth, more increase in the use of telehealth than there had been in the previous 20 years. But where are we now and where are we heading in digital health?
Pandemic was a boom to digital health, particularly those tele-interventions. I love not having to go to the physician office, driving 20 minutes down the street, waiting for 10 minutes in the doctor's office for, a 5-minute visit. When in some cases it's very obvious what's wrong. I can just call up and have a televisit very quickly. It has taken a little bit of a step back, post-pandemic, but it's definitely on the rebound now. And I then look forward to the future of digital health. It's that aspect of the data, the wearables that are out there and that are continually expanding in their capabilities, remote monitoring such that your physician can look at that information, in the intersection of the use of the AI technologies to understand that data to make those health improvements that we're talking about. When you think of, someone on their journey in terms of just regular literacy or health literacy, it's the AI can tell you and can explain something to you such that it makes sense to you. So I think there's a lot of potential for digital health. I'm judged on a lot of different startup competitions.
Yeah.
And the amount of Gen AI that's hitting these startup solutions now is amazing. And I look forward to it. I used an application just the other day that instead of guiding me through the startup experience with just, words that I had to read on the screen, it was an avatar that talked me through the experience.
Yeah.
It was a different experience. It was I look forward to seeing more things like that.
You've been working on AI for a long time. Back in college, we'd spoken about on the HealthBiz podcast, you were working in that. How significant a factor is AI in your work today?
I would say very significant. It's an efficiency factor. As I'm in software development, there's a lot of talk about how do you 10x as a software developer? How can you make a bigger impact? So as a software developer or as a physician, as an educator, how can you make a difference? I think AI is that technology. And it's not going to replace us anytime soon. It's to augment your capability. So as you are exploring an idea or have a particularly challenging patient, ask it, engage with that AI. And so as a quick marketing example, it's like, generate me 10 topics, to post about the use of generative AI in healthcare and cancer research. I can do that. I've done it many times, but I can click that button and it'll generate 10 in seconds. And I can click it again and give me 10 more, give me 10 more, give me 10 more. And it just really enables so much more from an efficiency perspective. So yeah, I think it has a significant impact on software development, on healthcare. And I look forward to what's going to happen.
Well, that's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with RJ about his life and career. RJ Kedziora, co-founder and CEO, COO of Estenda, thanks for joining me on HealthBiz Briefs.